Dear audience, Anna, Patricia and I, Lea, would like to welcome you to our debate. We will discuss the motion that Switzerland should limit the immigration of healthcare workers such as nurses or doctors. The background of this motion is that in most countries in Europe, we have free movement of people living in those countries. This means that you have the right to choose freely where you want to work or live within these countries. In practice, this means that if you go to a hospital here in Switzerland, you will probably be treated by a nurse or a doctor coming from abroad, as Switzerland has the highest amount of healthcare workers coming from abroad. In some areas of Switzerland, even 70% of the nurses are from another country. I support this motion to limit the immigration of healthcare workers because for me it seems that Switzerland takes advantage of this free movement of people in Europe without considering the problems this can cause to other countries. The World Health Organization, the WHO, also saw this problem and is trying to help the countries to have a fair balance of workers so that all countries can benefit of this free movement of workers in Europe. But this seems not to be the case for healthcare workers. Switzerland offers attractive working and living conditions and is motivating people from abroad to come and work and live in Switzerland. But those countries are losing the workers they educated and also need, which can cause problems in those countries. And Switzerland gets qualified healthcare workers who also often work for less money. Secondly, I argue that the healthcare workers from abroad have a negative influence on the quality of healthcare. The European Office of the WHO discussed that the quality of care and patient safety might be at risk if, for example, Switzerland doesn't know the qualifications and skills of the foreign-trained healthcare workers. So it is not clear if the skills and training can be directly used in Switzerland, but integrating healthcare workers from abroad takes a lot of time and is expensive. Furthermore, language barriers can be an additional problem. I also argue that planning how many workers will be needed in the long term is a challenge for Switzerland because healthcare workers from abroad only stay in Switzerland as long as they see advantages. Studies showed that many of the healthcare workers from abroad only stay and enjoy the opportunities in the short term and go back as soon as something changes. The coming and going of the healthcare workers from abroad makes it more difficult for Switzerland to plan its workforce, and Switzerland could lose its workers from abroad, especially if something happens we couldn't foresee and people suddenly move back to their country. This leads me to the conclusion that Switzerland should focus on educating enough healthcare workers of its own and make sure that it can keep a high quality of healthcare services, even when healthcare workers from abroad move back to their country. Then Switzerland would still have enough healthcare workers of its own and would not need healthcare workers from abroad. This is why I support this motion.
After listening to Leah's arguments in favor of limiting the entry of health workers into Switzerland, I will explain why I am against this motion and why I argue that instead Switzerland should not limit the entry of foreign workers. My first argument is that the quality of the health service in Switzerland is actually higher when professionals come from abroad to work in Switzerland. The reason is that health workers from abroad bring new skills that can be useful in Switzerland. Besides, before they are allowed to work in Switzerland, their skills and competencies have to be officially accepted and approved. Therefore, health workers coming from abroad strengthen the Swiss healthcare system because they can offer a more diverse and professional service. Secondly, while it is true that planning for the future is difficult when professionals come and go, right now the Swiss healthcare system is understaffed and Switzerland needs more health workers. The reason is that the Swiss population is living longer and therefore getting older, and this means two things. First, there will be more elderly people who will need more care, and second, a lot of health workers are getting closer to retirement age and will step down from their positions. The problem is that the next generations in Switzerland are not enough to fill those empty positions. So in order to provide the necessary care to an older Swiss population, Switzerland needs more and younger health workers, who often come from abroad. Finally, Lea claimed that when health workers come to work in Switzerland, this can cause problems in the countries where they come from. However, I argue that on the contrary, it can have a positive effect in those countries in the long term. During the time that the professionals spend in Switzerland, they have the opportunity to gain knowledge and skills that they might have not gained in their own country. Furthermore, one of Leah's arguments was that a high number of foreign workers eventually return to their home country. So when health workers return home, They will bring back the knowledge, skills, and experiences gained in Switzerland. In conclusion, Switzerland benefits from receiving younger, more diverse, and professional health workers. Immigration of workers helps cover the needs of the Swiss population while keeping a good standard of work. And last but not least, the countries where the health workers come from can also benefit from this exchange. Thank you.
Dear audience, we just heard Patricia and Lea discussing whether migration of healthcare professionals into Switzerland should be limited or not. Both brought up some important economic, social and political points to support their statements. However, when we talk about migration, we cannot exclude all the human and emotional experience related to this topic. With my first argument, I'd like to show you the importance that our emotions play when we think about strangers. Usually, people find migrants scary. But why? In past history, when a stranger approached our group, we had to recognize if this stranger was part of our community and therefore a possible threat for our survival. This behavior kept us safe. Nowadays, even if we live in touch with other communities, the fear of the stranger is still present. In 2016, the departure of the United Kingdom from the European Union started. This is called Brexit. Some may say that Brexit is an example of how the fear of the stranger can influence people's decisions more than fact. For example, after an anti-immigration campaign, the number of British voters who consider immigration as an important issue went from 0 to 45%. Therefore, when we think how to address the issue of migration, we cannot ignore how our emotion, especially fear, can influence individuals as well as societies. For my second argument, I will show you why fear of the stranger is particularly relevant for the period we are living in. Unfortunately, in times when we should stay together, we often see more forms of hate towards strangers than before. During economic and social crises like COVID-19 pandemic, many people blame migrants of bringing the virus in their country, and this has increased hate and intolerance worldwide. Also in Switzerland, where borders were closed for all but healthcare workers, people were anxious that the strong outbreak in northern Italy could affect people living in the Italian part of Switzerland. Following these events, the United Nations encouraged government to take actions to promote tolerance. Therefore, I believe that regulations that limit migrants' movement be carefully evaluated, especially when we think of present and future crises where forms of hate should be prevented. Coming back to our motion, immigration of healthcare workers into Switzerland can be considered a good or a bad thing at all. It's true it can bring benefits for both countries, as Patricia states, but it can also cause this problem if not appropriately regulated, as Lea suggests. I hope that these different perspectives gave you a chance to rethink our attitudes toward migration, and that concrete example I presented even inspired you to think and judge this issue differently. I personally believe that we can have for or against opinion without considering what migration still means for us and had meant for us in history. Thank you for participating in this debate, hope you enjoyed, and goodbye.